come on about these MRI reports. It's about when like symptoms that the patient is currently experiencing don't necessarily correlate with what we're seeing on imaging, and that whole idea of damage doesn't necessarily mean pain and things like that. There's no one-to-ones, but I wanted to talk about one today that is a more recent person, and how sometimes when you get the MRI report back, it actually matches perfectly with what you're seeing clinically and how the patient is presenting with their symptoms. And this person was in accident, fairly high speeds, and ever since the accident, which happened 3 weeks ago or something like that, we're just finally getting the imaging reports back. Ever since the accident, just severe pain in the low back and into the left leg, down into the region of the calf, and never feels better no matter what he does. Can't barely sleep. Really painful in the mornings. And when we get the MRI back, and we're not making a lot of progress either, just with very basic conservative things, and within 4 weeks, you would expect to have seen some sort of positive movement. And so when we get these back and you start reading through the report and you see, oh, we've got disc herniations 5.5 millimeter pressing on the S1 nerve roots. We've got severe left neuroforaminal stenosis. And when you start reading things like that, you say, oh, okay, now we have some information regarding an injury that is also presenting clinically as we would expect, given that there's that level of big disc herniation also directly pressing on the nerve root, where we're seeing the person have symptoms presenting down in that left leg. So this gives us some options with our interventional pain physician to possibly come in with some sort of injection therapies or something like that to try to reduce these symptoms. This will get better at some point eventually. Disc herniations heal up and things like that. But when we're starting to have direct compressions visible on MRI and symptoms, then maybe we want to get a little bit more aggressive in how we're thinking about treating to get this person symptoms down, get them back to their normal activities, and that way they can use a little bit more, or we can use a little bit more aggressive, like conservative therapies, if we can bring the symptoms down by utilizing some work with our interventional pain doc. So, these are situations where maybe it is time to get a little bit more aggressive, maybe not. And it's always up to the patient. We can just present some options that we think may move the needle a little quicker. And it's always up to them to decide what to do, how much these things are bothering them, and go from there. So in the meantime, just so you know that sometimes I read these reports and see stuff like this and the person has no symptoms. Sometimes we see these things and the person has lots of symptoms, and you just never know. You've always got to correlate clinically. Check out my page for more, and see you next time.